And here is your question. Right. So if you have read and understood, considering it critical care scenario, please tell me how would you manage this patient now?
Yes, I will manage this patient according to the CRIS protocol with the ABCD approach.
Yes.
I will manage the patient. I will assess the airway, that if the
Yes.
airway is patent, by talking the patient. And if the patient is not maintaining the airway, I will put on the definitive airway equipment. So to assess the breathing, I will assess the respiratory rate and the oxygen saturation. I will attach the cardiac monitor, do the respiratory examination, and
Yes.
attach the oxygen, high flow oxygen with the oxygen mask,
Yes.
and order the EVGs and chest X-ray.
Yes.
And proceeding further to evaluate the circulation, I will assess the pulse and blood pressure. I will put two wide bore IV cannulas and give IV bolus of according to the 10 to 20 ml per kg stat, and look for the response.
All right. Considering the stem, patient has already been given 250 ml bolus twice. Considering the situation of the patient and the vitals, do you comment on the fluid?
Yes, that
Yes,
means
sir.
that it is liquid in the post-op period. So that's why it is poor fluid resuscitation. That's why the patient
Yes.
is in hypotensive state.
Yes. So how would you fix that? What measures would you take?
Yes, as I've already mentioned that the secret protocol. So I will again give him bolus and look for the response,
Yes.
and
How much
put the patient.
bolus? How much bolus?
Yes, according to the 10 to 20 ml per kg stat.
Okay. Over how long?
Yes, until the patient is responsive, and put the patient on the maintenance fluid.
How much
And,
maintenance fluid would you give?
yes, according to the 100, 50, and 20 protocol, that means that for the first 10 kg, it will be 100 ml per kg. Then for the next 10 kgs is 50 ml per kg, and for the remaining weight, then it will be 20 ml per kg over 24 hours. And I will look for the response if the patient is
Okay.
responsive or not.
How would you take care of the blood pressures of the patient?
Yes, again by giving him the boluses and look for the responses. That includes the clinical parameters. That includes the capillary refill time, peripheral temperature, pulses, BP. Or if the bolus is not working, so we can give him the blood products as well, and the inotropic support.
Yes, inotropic support. Right. Discuss. Tell me which inotropic support would you give and what would be the dose?
Yes. Yes, it would be adrenergic agonist that includes epinephrine, norepinephrine, or it could be the dopamine as well.
What is their mode of action of adrenergic?
Yes, they increases the systemic vascular resistance. So, as BP is the product of cardiac output and systemic vascular resistance, it acts on the peripheral vasculature and it causes the vasoconstriction.
Okay. How would you calculate blood pressure
It is the product of the cardiac output and the systemic vascular resistance.
or the total peripheral resistance? Okay. Right. How frequently would you be monitoring this patient?
This should be the patient should be monitored hourly.
And what factors would you keep in your mind while you're following up or monitoring the
Yes,
patient?
in the monitoring, there would be non-invasive or clinical monitoring
Yes,
that includes the conscious state of the patient initially.
very good.
Uh,
Yes,
and then we can assess the temperature of the peripheries, the capillary refill time, the pulse,
yes,
the blood pressure, and the jugular venous pressure.
yes.
And we can also, and there would be the invasive monitoring that includes the CVP monitoring, or that could be the arterial line, invasive arterial line, or lithium diluted cardiac output measurements, or transesophageal echocardiogram.
Out of all these monitorings, what exactly criterias would you consider for monitoring of fluid balance?
Uh, I would preferably opt for the CVP monitoring.
And there are many
Uh,
others you can do. We can discuss that later if you can't come
yes,
up
ma'am.
with them right now. Okay. Uh, what factors would you keep in your mind in order to determine how much fluid you should give?
Uh, yeah, that the BP and pulse should be stabilized, and the patient should be responsive
And
with the fluid volume. And yes, and the most important thing is the urine output.
yes, and
And this
fluid deficit because patient is post-op. So you would have to keep that in your mind as well. Any comorbidities with patient has or presents. Here patient is already operated. All right, okay. What is the basal water requirement for an adult? Normal.
sorry, ma'am, I could not understand the questions.
What is the basic or basal water requirement for an adult?
It is according to the maintenance fluid, as I've already told you, that is calculated by the 100, 50, and 20 formula.
Which fluid would you consider giving to the patient as a maintenance dose and why?
Yes, in the post-op period, I would uh, give the patient 5% dextrose saline, as it contains the dextrose water and the normal saline as well.
Okay, any other fluid you can give?
Yes, we can give him the isotonic solution, isotonic fluid that includes the 0.9% normal saline or the ring lactate solution.
All right. Would there be any benefit of giving normal saline with the potassium or any Hartmann solution to the patient?
Yes, it contains the potassium, so that would replenish the basal electrolyte requirement of the patient.
Okay. Can you please tell me what are the most likely causes in this particular patient which has led to hypotension?
Yes, as the patient is in the post-operative period, so there could be the chance of the occult hemorrhage.
Okay, and
It could be secondary to the anesthesia drugs,
yes,
and
and
it could be secondary to the poor fluid resuscitation.
yes. All right, good. Dehydration. Right. What more? How would you take care of the nutritional status of the patient in this situation?
Yes, I think it's a immediate post-op period, so we can give him nutrition by the IV fluids,
Okay.
and if there is there is a chance of the prolonged NPO, so we can put him on the TPN or PPN.
Okay. Can you name few conditions or situations in which there is increased requirement of the maintenance fluid?
Yes, it includes the a burns patient, the patients with the acute pancreatitis,
Yes.
and there could be the prolonged surgery, and when there is uh, a large amount of insensible losses.
Okay, good. Thank you. Time went. Thanks. Good.